Hi guys, welcome to Primal 7's Hip Q&A. I'm Jenna Ellis, physical therapist for Primal 7. Today we're going over a few questions that we got from the internet, Facebook, and Instagram from you guys about your hips. So we'll move along to this question. It says, I have right hip pain and weakness. Long term, it's painful to sleep on that side, and I'm a that side sleeper. So it affects my ability to rest as well. I've been told bursitis and tendonitis. I've done regular PT exercises on ice and heat. It does get a little better at times, but flares up when I work out with any regularity. My knee on that side is now also painful when I walk up and down stairs. Any suggestions? Well, hello, thank you so much for your question. I'm sorry that your hip is continuing to give you issues even after you've gone through a little bit of what you said, a round of PT. At this time, when you say you're starting to have a secondary injury at your knee, it might be time to go back to your physical therapist or your doctor so they can get a good one-on-one in-person look at you just to make sure that there's nothing else kind of brewing underneath the surface. We don't want things progressing, so please make sure you get it checked out so that you can kind of move along and start to get into your exercise routine again without seeing any significant delays. One thing that I would start to look at is your actual exercise routine, making sure that your postures are in good alignment while you're going through these exercises. Sometimes as we're going about our exercise, we might not think about our posture or might not think that we're out of alignment. But if you rotate the foot out a little bit too much on one side or squat a little bit too low or bend your knee in, something like that, it can throw your body out of alignment. And that repetitive over and over motion will kind of exacerbate things. So we want to make sure you're in good alignment and staying in nice, easy reps. Other things to look out for too is that you're using proper weight when you exercise. Doing exercises too heavy can cause an overload, and it can cause you, actually, if you have a dominant side, to push a little bit more, let's say up out of a squat, using that left leg just a little bit more, putting a little more stress and strain on the left hip. One thing that I've done in clinic and given people home exercise programs with is actually starting a low impact exercise routine such as swimming. It's a great exercise program, but also it takes a little bit more stress and strain off your joints and allows you to fluidly move in the water without that weight-bearing constant pressure on your joints. That can kind of help get you back in line again and in a little less pain. And then after you've started doing this and you see a little bit more progression, you can slowly add back in some of your old exercises that you like to do. Just make sure you're doing them with good alignment. We also want to make sure that you're staying stretch out. Stretch out those quadriceps and hip flexors and the muscles in the back of your leg, your hamstrings. Also your piriformis and your inner thigh muscles, trying a butterfly stretch to kind of help get those hips a little bit more loosened up. You can also foam roll. I do really like foam rolling my IT bands and my glutes. I just want to reiterate though that there is a little bone on the outside of your hip. It kind of juts out to the side. That's actually where you might have some pain if you have bursitis. We don't want to roll right over that bone because there is a bursa sitting right there. We don't want to anger him, so just kind of go below that. So you're going to go below that bone all the way down the outside of the leg to the top part of the outside of your knee. And you can also go on your quadriceps. Just think, go over the meaty parts of your leg. No bony prominences at all. Well, I hope this gives you a little insight to continue on your journey, hopefully getting yourself out of pain. If you have any further questions, please let us know. Thanks so much.